Movement, right side. The glenohumeral, the action is flexion and adduction. The agonists are coracoid branchialis, upper pectoralis major, anterior deltoid, supraspinatus, and all of the deltoid. The antagonists are the subscapularis, posterior deltoid, lower pectoralis major, teres major, and latimus dorsi. The plane of motion is sagittal. The axis of motion is frontal. The type of contraction for both actions are concentric. The scapulothoracic action is protraction. The agonists are the subclavius, the pectoralis minor, and the satirius anterior. The antagonists are the trapezium, lower and middle, and rhomboids. The plane of motion is the frontal plane, and the axis of motion is the sagittal. The type of contraction is eccentric. The elbow. The action for the elbow is extension. The agonists are the tricep branchies, all of them, and the incus. The antagonists are the bicep branchies, all of them, the branchialis, and the branchioradialis. The plane of motion is sagittal, and the axis of motion is frontal. Type of contraction, eccentric.
The movement phase of the wrist and hand, it's still at a neutral wrist with the finger flexion. With all the same muscles in place for flexion of the fingers, and the antagonists are the same, such as the extensor digitorum, extensor indicus, extensor digiti minimi. And finger flexion occurs about the sagittal plane in the frontal axis. The held fists are, of course, isometric contraction. And this occurs on both sides, the right and left hand or wrist, on the radial ulnar joint on the right side. There is further pronation because of the twisting of the forearm, and or wrist, which is pronation. And of course, the same muscles apply for pronation, which are pronator teres, pronator quadratus, brachioradialis. The antagonist for the pronator is supinator and the biceps brachii, and the pronation occurs in the transverse plane about the horizontal axis, and still it is concentric contraction.
The left knee is in slight flexion and external rotation. The agonist muscles used are the popliteus, semitendinosus, semimembranosus, and biceps femoris. The antagonist muscles are the vastus lateralis, medialis, and intermedius, the rectus femoris, the popliteus for internal rotation, the semitendinosus for internal rotation, as well as the semimembranosus for internal rotation. It is in the sagittal plane and frontal axis for flexion, and the transverse plane and longitudinal axis for rotation. They are both concentric types of contractions. The hip joint is in external rotation and extension. The agonist muscles used are the gluteus maximus, the 6 deep external rotators, the biceps femoris, the long head, as well as the semimembranosus and semitendinosus. The antagonist muscles are the gluteus minimus, the interior fibers of the gluteus medius, tensor fasciae latae, iliopsoas, rectus femoris, pectineus, as well as the sartorius. It is in the transverse plane and longitudinal axis for rotation, as well as the sagittal plane and frontal axis for extension. They are both eccentric types of contractions. The pelvic tilt and rotators are anteriorly rotating. The agonist muscles used are the quadratus lumborum, tensor fasciae latae, rectus femoris, and the iliopsoas. The antagonist muscles are the rectus abdominis, external obliques, internal obliques, gluteus maximus, biceps femoris, semimembranosus, as well as the semitendinosus. It is in the sagittal plane and frontal axis and is an isometric type of contraction. When in the movement phase of the punch, the right knee is in slight flexion. The agonist muscles used are the popliteus, semitendinosus, semimembranosus, and biceps femoris. The antagonist muscles are the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. It is in the sagittal plane and frontal axis and is a concentric type of motion. The hip joint is in flexion, abduction, and slight internal rotation. The agonist muscles used are the sartorius, pectineus, tensor fasciae latae, rectus femoris, iliopsoas, gluteus minimus, medius, as well as the gluteus maximus, the upper fibers. The antagonist muscles used are the gluteus maximus, the 6 deep external rotators, biceps femoris, the long head, semitendinosus, semimembranosus, gracilis, and the adductor brevis, longus, and magnus. It is in the sagittal plane and frontal axis for flexion, frontal plane and sagittal axis for abduction, and transverse plane and longitudinal axis for rotation. It is a concentric type of contraction for both flexion and abduction, and eccentric for rotation. The pelvis is in anterior pelvic rotation. The agonist muscles used are the quadratus lumborum, tensor fasciae latae, rectus femoris, and the iliopsoas. The antagonist muscles are the rectus abdominis, external oblique, internal oblique, gluteus maximus, biceps femoris, semimembranosus, and semitendinosus. It is in the sagittal plane or frontal axis and is a isometric type of contraction.
The follow through. The right side. Glenohumeral. The action is flexion and adduction. The agonist is the coracoid branchialis, upper pectoralis major, and anterior deltoid. The antagonists are the subscapularis, posterior deltoid, infraspinatus, subscapularis, posterior deltoid, and teres major, and latimus dorsi. The plane of motion is sagittal, and the axis of motion is frontal. The type of contraction is concentric. Scapulothoracic. The action is protraction and elevation. The agonists are subclavian, pectoralis minor, serratus anterior, elevatory scapulae, rhomboid, trapezium, upper and middle. The agonist is the trapezium, middle and lower, and rhomboids. The plane of motion is the frontal plane, and the axis of motion is the sagittal. Type of contraction is eccentric. Elbow. The action is extension. The agonists are tricep branchi and incus. The antagonists are all the bicep branchies, branchialis and branchioradialis. The plane of motion is the sagittal plane, and the axis of motion is the frontal. The type of contraction is eccentric. Left glenohumeral. The action is extension. The agonists are the subscapularis, posterior deltoid, lower pectoralis major, teres major, latimus dorsi. The antagonists are the coracoid branchialis, upper pectoralis major, anterior deltoid. Plane of motion, sagittal. Axis of motion, frontal. Type of contraction, isometric. The scapulothoracic. The movement is elevation and upward rotation. The agonists are serratus anterior, trapezium upper, middle, and lower, elevatory scapulae, and rhomboid. The antagonists are pectoralis minor, subclavia, and trapezium lower. The axis of motion is sagittal, and the plane of motion is frontal. Type of contraction is isometric. For the elbow, the movement is flexion. The agonists are the tricep branchies, all of them, the branchialis and the radial branchialis. The antagonists are the tricep branchies, all of them, and incus. The plane of motion is sagittal, and the axis of motion is frontal. The type of contraction is isometric.
For the follow-through phase of the wrist and hand, the finger is continued to be flexed and with a neutral wrist, and the same muscles occur for flexed fingers, which are the flexor digitorum superficialis, flexor digitorum, and profundus, flexor pollicis longus. The antagonists to those muscles are the extensor digitorum, extensor indicus, and extensor digiti minimi. The finger flexion occurs about the sagittal axis at the frontal plane, and once again, the fingers being flexed into a ball of fist are considered isometric contraction. And this occurs in both hands on right and left sides. The radial ulnar joint is the pronation / isometric action for the right side. And the same muscles are involved for pronation, and the antagonists are supinator, the biceps brachii. And pronation occurs about the transverse plane with the isometric contraction. The left side for the radial ulnar joint is the same.